Hello to my beautiful Laredoans. I thought I'd give you a glimpse of what's going on in the front lines today. I'm going to talk a little bit about Laredo Medical Center because that's where I reside. We have 280 beds. At present, we have 131 of them occupied by very ill COVID patients. Of those 131, 42 are in the intensive care unit, and 34 of them are intubated. And we all now know how difficult it is once you become intubated. I don't know how else to convey the urgency to all of those who have the authority to help us. Those with the authority are the government. In Texas, the governor. I'm signing 5 to 7 death certificates every day, and that is quite disheartening. To put it simply, I think that before this next 5 months are up, I think 1 in 250 Laredoans will die. Our census is 280,000. We're nearing 600, and there will be many deaths to come in the next month or two. The virus has changed. It is much more contagious. For some reason, Laredoans are coming in later in the disease process. And if you come in after 12 to 14 days, we have nothing to offer you with respect to medicines. Nothing that will have a significant effect. So I would like to emphasize to everybody that if you develop COVID, make sure you see your doctor by the 5th day of the symptoms. Make sure that you're going to be in the low risk profile. Because if you're in the high risk profile, there are things we can do to help you, but you have to get to us early. To our city government, to our state officials, to our governor, you are failing us. You're failing us in a big way. It is time to close the city for 2 weeks, maybe 3. We did it once when we were full. And we went from the hospital at capacity to 3 COVID patients in 3 weeks. It will not stop COVID, but it will reduce the deaths. Because at present, we have so many COVID patients that our nursing staff, our physician staff, our medicines, our respiratory techs, we're stretched to the limit. People don't get everything that they need, and that's just understood. But we are stretched to the limits, and more people than should will die because we have no room. We have tents, we have other sites. We put up the Red Roof Inn before as a place to put patients. Yeah, it's a bed. It's not high quality medicine. So to the governor, it's okay to swallow your pride. It's okay to say that you're not going to do it and then do it to save lives. If government doesn't work, if it doesn't assist us, if it makes decisions based on economy instead of based on life, then it fails us. And the government has failed us many times. It failed us with the right to vote with women. It failed us with equal rights for African Americans. And how did we correct that? We corrected it with civil disobedience. In other words, there are some times in our lives when everyone has to understand that there's a better way. I understand business owners worrying for their business. I worry for mine. But I promise you this, the 600 families that have experienced a death, the 130 families that are in our hospital here just at Laredo Medical Center, the 34 patients who are intubated, their families, they have no doubt that they should have stayed home, that the city should have been closed. 1 in 250 Laredoans will die if we don't change course. So, if the right for a woman to vote was important enough for civil disobedience, if the right to treat African Americans equally was enough for civil disobedience, well, our government is failing us, and so we should do it ourselves. I've gotten so many requests from teachers, from city employees, to beseech those in power to let them stay home. What I tell each one of you is, if all of you stay home, we can't fire you all. Where are the unions for the teachers demanding that their members stay home? Sure, alternating shifts is better, but it's not going to do the trick. The only thing that will save lives at this point will be staying home and shutting down the city. So I challenge each and every one of you to discuss this tonight with your loved ones and to make the right decision. And I understand the argument will be, well, we need the paycheck to survive. In times of war, we have survived with much less. In the last 24 hours, I've admitted a 20-year-old, a 24-year-old with no comorbidities, no other illnesses, and they have severe, severe COVID pneumonia, and they are fighting for their lives. Ask their parents what the right decision is. But if we all act together, and if everyone does the right thing, then the government will have to respond. And as I've said many times, think for yourself. Look at your husband, look at your wife, look at your father and mother, look at your child. Imagine them intubated in the intensive care unit. And then answer that question. Some will say that this is alarming. I don't mind alarming people if it's the truth, so that we can prepare and respond. With that, I leave you all, and I love you all. Good night.